Hey everybody, it's November 1st. Dr. Brace here for Facial Plastics Friday, and today I want to talk about something really basic, really simple, and that's wound care. Every patient that I operate on will have a wound, will have an incision, will have a suture line, and these all require some sort of wound care. It always amazes me that people will invest in a surgery and then will completely ignore the instructions that we give them to help them get the best scar possible. It's impossible to do surgery without a scar, and we want you to have the best scar possible. And so wound care is really, really important. Part of that is antibiotics. Often when we're operating on the head and neck, the nose and the mouth are in the field and you can't sterilize those. And so I do prescribe antibiotics for people, and I still am amazed when I'll have patients that come back at 1 week with redness and pain and maybe an angry looking wound, and they will not have taken their antibiotics because they're against taking them for whatever reason. It's really important that if you sign up for any sort of cosmetic surgery, that you are also understanding that you're signing up for the aftercare, and that includes following your instructions for wound care and taking your antibiotics and the medications that are prescribed to you. Sometimes we'll prescribe steroids, and that will help reduce the inflammation and the swelling, which will reduce the tension on your scars and will help your scars look better. So there's a reason for every medication we give you. But in terms of wound care, if you have, say, a facelift incision in front of your ear and down and around your ear, it's going to likely get scabby. And scabs are the prime breeding ground for bacteria to grow and where superficial infections can start, and those can go deeper. And so we ask our patients to do a very, very gentle cleanse with a half-strength peroxide and water, or Hailderma, which is hypochlorous acid. That will kill the bacteria on the skin. And then after that, we ask you to put an ointment on. And I'll tell everybody, it doesn't matter if it's polysporin, if it's bacitracin, if it's Aquaphor, if it's Vaseline, if it's coconut oil, if it is shortening. Any of those greasy ointments can be placed on the wound, and that is a water barrier. Wounds heal faster, at least 50% faster, if they're kept moist. And so it's really important, if you want the best looking scar as quick as possible, you keep it free of scabs and you keep it greasy. And it really doesn't matter what you read on the internet. I'm, again, always frustrated when people come and say, well, I Googled it and this is what Google told me. Don't listen to Google. Listen to your surgeon, to the instructions they give you based on the sutures that you had and the surgery that you had, and that will get you the best outcome possible. So that's it for Facial Plastics Friday. Wound care is really important. Don't ignore your surgeon's instructions. Follow them to a T. And if you have questions, call, and we're always happy to walk you through what you need to do and why you need to do it. Everybody have a great weekend, and that's it for Facial Plastics Friday.